Greetings from Narayana Health. I am Dr. Kumar Pankaj, Senior Resident, Department of Urology. Today we have a guest who is very famous in the field of urology. So let's welcome him. He is none other than Dr. Prashant Kulkarni, Senior Consultant, Department of Urology, Narayana Health.
Thank you, Pankaj.
Sir, so you'll be today. It's a pleasure for us to have you in this discussion. We would like to have a discussion on prostate gland particularly because we see many patients coming with various symptoms and all that. They will tell like, sir, I have a prostate problem and this problem and that problem. So I would like to know first of all, what is a prostate gland, sir?
Okay, Dr. Pankaj, first of all, prostate is an organ which is present in all males. Actually, this is required for our sexual activity. As I said, it is a male reproductive organ and naturally it is not present in females. And usually the prostate starts growing from the age of puberty. And we see in our regular practice prostate related problems in two groups of patients. One in younger age group patients and second one in older age group patients. Younger age group patients usually will have infection as the cause for their prostate problems. It means that if somebody's prostate is infected, then only they will have symptoms. Otherwise, it doesn't give any symptoms. Young means what? It is less than 50 to between 60 or otherwise less than 6th grade of life. Okay. And if we take other group like elderly patients who are 60 and above, in them because of the size itself or otherwise the prostate causing obstruction to the urinary passage, means if somebody's passage is blocked because of the prostate, and they will also may present to us with the symptoms.
So you are telling about the symptoms they will present. So what are the symptoms these patients are going to present to you with?
Okay. Younger patients, usually they will have a burning sensation or sometimes difficulty in passing urine. But especially in older age group patients, there are less number of group of patients where they don't have any symptoms. Many patients we see in our OPD, elderly patients, they have come to the OPD or after master health checkup with a report saying that their prostate is enlarged. Means there is a set of patients who are asymptomatic, but in their body the prostate is growing. Second is that group where patients are presenting with symptoms of prostate, like what? As I said, it is in the urinary passage. If the urinary passage is blocked or compressed because of the prostate, then they will have difficulty in passing urine. Few patients may complain that after passing urine, they are not able to feel that the bladder is completely emptied. It means that their urine is not satisfactory. They go for urination many times, especially in this group of patients, this elderly male, many must have seen in their house also. An elderly male is getting up too many times in the night. Their sleep is disturbed. These patients needs to undergo evaluation for prostate.
Okay, sir. So with these symptoms complex, many female patients must be also approaching to you, sir. These are the problems.
Yeah, so, it's a nice question, Pankaj. Actually, as I said, it is a male organ. Females don't have prostate. But female in their elderly age, they will also complain with come to us with some amount of urinary symptoms. They will also have difficulty in passing urine. They are also getting up too many times. And one more important problems in elderly females is the leak of urination. See, in these patients, in elderly females, the urinary problem is mainly because of the urinary passage. Okay. As because of their age, this hormonal levels will come down because many must have attained their menopausal state. Okay. Second one is their muscles are weak. Okay. That's why their control over the urination goes. That's why many patients come to us with urinary leak or sometimes not able to pass urine.
One more thing I would like to know about prostate, sir. Like we will see some ads, some public awareness program in which they mention that old age patients should go for PSA checkup and all that. So basically, I would like to know what is the PSA, how is it significant for patients, and how you evaluate and all that.
Okay, this is one important thing nowadays. PSA test is already included in the master health checkup, and it is in a way it is good also. Why I tell you, PSA is a one test which will determine that is there any abnormality that is happening in the prostate or not. What is PSA? If you expand this PSA, it is a prostate specific antigen. See, it is one of the chemical which is present in our body, which will be increased with the prostate problems. What are these problems? Either it can be because of infection,
Okay.
because of the age, because of sometimes cancer, or sometimes if patients have undergone treatment for prostate, then also there is a variation in PSA value. It means to say that PSA, if it is raised, it will only tell that it is something is happening in prostate gland. It is specific to prostate, but it doesn't tell that if somebody's PSA is raised, that person has got cancer. Many people in general public, they are worried that PSA, if somebody's PSA is raised, they have got cancer. No. For the reason for the PSA to raise, there are many reasons. Out of that, one is cancer. That's why we are all worried if somebody's PSA is high. But as a clinician, in our practice, what we should do is, by a series of tests and as well as examination, we should identify what is the cause of raise in PSA.
Okay.
And then subsequently evaluate them for if there is an infection, treat them. If there is a suspicion of cancer, we will have to find out or submit them for few more tests to identify for cancer. And if cancer is found, then submit them for surgery or treatment.
So, sir, would you like to tell that any age group or any age bar above which the patient should go for this PSA testing, or he should wait for the symptoms to appear?
Okay. As I said, first of all, prostate is situated in our body in such a position where it hardly gives any symptoms to the patient. That's why we usually evaluate all these patients in their early age group. Means, what is the early age for us? If you see patients who are coming for master health checkup,
Yes.
who should undergo master health checkup? That is one thing. See, after 55, it is better to submit all male population to at least once a year master health check. Why? Because there are many diseases or problems in our body which will give symptoms only once it is advanced.
Okay.
If we are identifying a specific problem in early stage, then we will be able to give better results. That's why instead of waiting for a patient to come with the symptoms, it is better to submit them for at least once a year master health checkup. Nowadays, master health check is available everywhere and it is more available at affordable cost. Okay. That's why I would like to pass on a message through this talk, this talk, that at least after 55, once a year check, and especially PSA, once a year check after 55 to 60 years is must. Okay. And then once the PSA is raising or somebody's PSA is static, your clinician will be able to judge you better in treating some of the problems tomorrow if a person.
But patient, once they come to know that their PSA is raised, they should not worry about that it's only malignancy or cancer like thing.
Correct.
Correct.
Actually, if somebody's PSA is raised, just go to your clinician or to a urologist, let him examine. Let him identify what is the cause of the raise of PSA. PSA to raise, one of the cause is cancer.
Yes, sir.
He will submit you for few tests, examinations, and then he will use his clinical acumen to find out whether the PSA raise in one gentleman is because of cancer or what. Yeah. And then he will submit you for some treatment. That's why that myth or that fear general public should not have, telling that somebody's PSA is raised, that the straight reason is they have got cancer.
Thank you. This is a very important point for our audience. So, sir, how you treat the patients, means who approach to you with the symptoms or incidental finding, you say, like they came to know by the reports or master, how you treat them patients? Okay.
Now, as you are asking for treatment, naturally they have got symptoms. See, we don't treat any general public people, one who doesn't have any symptoms. If a person has got a symptom, like if they have got urinary symptoms, difficulty in passing urine, somebody is getting up too many times in the day, then we categorize these patients into three groups: early stage, middle stage, or late stage. Before that, we submit them for few examinations and as well as tests. What is that examination? If a person, one who is coming to urologist or a urology OPD, first thing a doctor, what he will do to the patient is first he will examine him thoroughly after taking history, like whether he is a diabetic or what, whether he has undergone any surgeries in the past or what, or whether he is on any regular medications at present. And then he will examine him. He will examine the prostate. What is prostate examination is? It is a digital rectal examination where a doctor will examine a patient and he will feel the prostate. See, that is very important. That will give us an idea what is happening in the prostate, and as well as a doctor will come to know what is the size of the prostate. See, treatment depends upon the size also. And after this examination, and your doctor will ask you to undergo few tests. Out of that, basic things we should assess his urinary passage by doing uroflowmetry. Second one is ultrasound. Ultrasound will determine the prostate volume and the amount of urine that is left behind after passing urine. And third thing is PSA. See, after all these tests, a doctor will assess and he will directly rule. If he rules out that gentleman doesn't have any prostatic cancer, he will now assess whether this patient, where does this patient, if he is an early stage, if a patient has come up with mild symptoms, naturally that patient will keep him under some amount of lifestyle modification. In second stage, we prescribe some medicines along with lifestyle modification, and in later group, those type of patients where their medical treatment is failed, all those patients will only go in for surgical treatment. We have got good number of surgeries and good number of drugs that are available to treat these patients. People should not be worried that if somebody has got prostate problems, they will be submitted for surgery directly. That's why meet your clinician, or a patient should go to the clinician, discuss with him what type of treatment that they are going to receive, and then go ahead.